All right, brother. Hey, thank you so much for being here, man. It's an honor. It's a privilege, and I respect you for doing this. I love you, dude. Let's get into it. How are you doing today? And let's talk about, before we get into the full topics of things. Let's talk about you and your life. You know, you're married, you've got kids, and what you do for your stream.
So offline content is my primary thing. I try to create videos of 100% completing games, whether they be like achievement games or just like doing everything you can do in a Zelda game or a Pokemon game that don't have achievements. And I just happen to be able to stream that. And so that's pretty much all the content that I stream.
And how many kids do you have? And your wife, right?
Yeah, I've got a wife. We're married. We've got 2 kids. One of them's 2 and the other turns 5 in like a week and a half.
That's awesome, man.
Keeps
5 and then
growing up
2,
too
right?
fast.
Yeah, man. And I think that's a huge part of some of the mental health awareness is who's in your circle to help you deal with some of some of the things that life throws at you. And my wife and my kids are always there for me. But she also helps me stay grounded and helps me understand that like I'm not insane for thinking the way I do think, but she kind of comes back and be like, well, you probably should have done this instead. And so that always helps out too. It's always nice to have a good partner that can help you stay grounded. Okay, so life growing up with bipolar disorder, right? So tell us about that growing up, and then kind of like go through, growing up as a kid, your teens, and then as an adult, and where all that kind of falls in line when it comes to your mental health throughout this whole time.
Yeah. So I grew up, I wasn't diagnosed with anything until I was 24, 25, sometime in that time period. And so growing up, I had no idea that I even had any mental health struggles, especially because my parents are my kids are normal. We don't struggle with anything. If you feel sad, pull yourself up by the bootstraps. And so I had struggles, like looking back looking back, there are a lot more things that are apparent to me that I wish like we tried to deal with earlier on. But bipolar can present itself in a lot of different ways for people. And for me, like there are 2 sides to bipolar, which is why it's called bipolar. As a kid, I would get really hyper fixated on things. And so I would even as a teenager, completely disregard all my classwork for whatever my obsession of the day was. So if it was origami, like I'd be at church making little origami birds, in school making little origami, like I would just be that's the only thing that mattered. And then on the other side, during those periods of obsession, growing up and as an adult, I don't feel depressed. I feel very like energized and manic by whatever this obsession is. And then whenever inevitably it would just kind of fall off, like the origami thing, for example, I would make like super fancy origami birds for the girl that I was dating. And then it would be 3 months later, the obsession is just completely gone. I have no care in the world for it. And I'm super depressed because I have no hyperfixation anymore. And that's kind of the way that it presented through most of my childhood and adulthood. And my parents always just kind of thought I was a little bit of a quirky kid, which I kind of was. But those periods of depression were sometimes difficult. And just by nature of the way that I was raised by my parents, and like we pick ourselves up by the bootstraps and we deal with whatever's going on, and we don't have any mental health problems because we're stronger than that, was kind of like the mentality that I was raised with.
It's the pride, right?
Exactly. And I was very interested in medicine growing up. So my freshman year of high school and throughout different years of high school, I took health classes, and I took biology and a nat and phys in, I think it was my freshman year of high school, that I went through the symptoms of depression. I learned them. I had to memorize them for tests in school. And just because of the way that I was raised, it was just like, that doesn't apply to me. So I would read it and be like, so these are the symptoms that people struggling with mental health crises feel. And I would check off 9 out of 10 boxes and still be like, well, I don't fill out 10 out of 10. So that can't be me. Because it's the way that I was kind of raised to look at it.
Yeah, I mean, it's the same, like, growing up, my dad was just always like, boys don't cry, and, we don't show our emotions, and it's kind of what we've talked about in previous episodes. You deal with your emotions internally, and you just handle your business. You take care of business, you take care of your family, you do, there's no reason for you to show what they call weakness. And kind of like it's a pride thing too, because if your parents weren't really acknowledging that you may have something going on, it's a pride thing. Like, oh, my kid's normal, he's just going through a phase. And it's like, well, no, it's like, if it's a continual phase that's going on throughout his life, there's obviously something going on. You probably should get him checked out. But but then there's also the other side of, we don't know what our parents' insurance is, covered, or what what they're dealing with that, and and
Good point
And
too,
no,
yeah.
that could have been a reason why they never took you to go get seen, or because like I'll tell you what, like I don't take my kids to the doctors unless I absolutely have to, and like we got good insurance, so it's not like I'm struggling there. But at the same time, when I was struggling with my own insurance before my kids, I always got tired of going to the emergency room for something that I thought was important, and then they're just like, oh, you're just a allergic reaction. Take some Motrin and we'll send you on your way. And then next thing you know, they're like, oh yeah, by the way, that 5 minute visit that you sat in the waiting room for 4 hours for, it's $175. I'm like, wait a minute, what? And they didn't even help you, like So that could have been also the same case in the '90s, early 2000s, or even late '80s. Who knows? But at the same time, my father-in-law, when we first found out my youngest one was autistic, like they didn't really acknowledge it. They didn't really want to acknowledge it. They're like, oh, maybe he's just, because there are some kids that grow up delayed, and it's okay, right? But then there's also that part where it's just back in that time there was that culture of like, no, my kids are normal. We'll snap them out of it. It'll be okay, whatever. And even with my kid, my oldest one, I teach him some tough love too, and like I kind of tell him like, why are you crying for? And it's not like I don't want him to express his emotions or to not express his emotions. I just don't need him crying to do that. And it's like, it's okay to cry, but you kind of have to, I guess, for lack of better terms, man up a little bit and kind of use your words so we can understand what's going on, because no one understands you telling us what's going on while you're crying most of the time. So it's like, okay, you can cry, but like, okay, okay, that's enough, man. Turn the waters off and let's discuss what's going on, like why. And then like I let him, if he's willing to, I let him say his mind, and like he's very cognizant of like using curse words and stuff. So he's like, but Dad, I can't say that word. I'm like, so I think I can relate to what you went through in that sense of, our parents having too much pride to allow us to express what we were feeling and concerns for them to understand like, yo, I need to get checked out, or I need something, to kind of identify there's something, like I'm not feeling something, I'm not feeling that it's right or whatever. And so that's kind of frustrating for you. But it's actually cool that you kind of like as a freshman, which is what 14, 15 years old, you kind of took it upon yourself to kind of deep dive into something that, was interesting to you, that you ended up
Yeah.
finding out later on that, affected you in the end.
Yeah, to some degree. And I like the way that I grew up to like, granted, it caused more problems later, but I think it's made me a lot better of a parent because I know to teach my kid, like, because I don't, when I was that age, even though I was reading these things on a page of symptoms of things, I still had no idea how that equated to the way I felt. Like, I didn't know probably until my mid 20s or later what even some of these symptoms really meant,
Right.
like how that felt inside me rather than like what does I can't remember the way it's worded in the DSM-5, but like you feel extreme sadness. Like at what point is extreme sadness depression, and when is it just like I broke up with my girlfriend?
Right. A normal thing. Yeah. Yeah. What's the norm? And so that, I mean, you're right. I mean, there's a lot of times where like even like because I have to get like an annual physical for example, and like I don't know how to explain like what that is to the
Yeah.
doctor to get them to understand like, hey, you need to take me seriously, or even just simple symptoms of whenever I hurt my something, and like I can't tell you what that feeling is because I don't know how to describe what that feeling is, because then I feel like when I don't describe it or I say the wrong thing, they don't take me seriously, and they're like, "Oh, we just put some ice on it, and you'll be fine." Like, here's a
Yeah.
Motrin, and it's frustrating because like as a kid, like you definitely a lot of times kids don't, kid and teens, whatever, they don't necessarily know how to express that because it's not taught. It's not one of those things that's taught in school that you get to know what these definitions of symptoms are until later on, like you
Yep.
said, you use WebMD or something like that, and then. But then there's also the other side of things where like my wife likes to do this a lot too. Whenever she like feels like there's something seriously wrong, she goes to like a WebMD or to Google, and then like she's like, "Oh my god!" I'm like, I was like, let's go get it checked in, whatever. But don't make it worse than it really is, and let's hear it from the doctor." And then again, it's really hard to trust doctors nowadays because there's a lot of people that I've known personally recently talking about how like one doctor said one thing, and then they get another doctor
Oh
later on
yeah.
down the road and they say
Well,
another thing. Like it's like, oh my goodness,
there's some of that in my story that we'll get into too.
Right. Okay, so let's that's a good segue then. Prior to being diagnosed, like what symptoms did you experience that caused concern and helped you realize your mental health was dwindling?
What really connected that made me realize there was a problem was my wife. She brought up the symptoms of depression that I was oftentimes experiencing, but kind of looking past, and she was like, "Hey, like something's going on. And that happened really early on in our marriage. She was just like, it's not normal to feel the way you're feeling. And so, in a lot of ways, getting married was a huge blessing because I was able to figure out kind of some of these things that I was struggling with because she could, as an outside observer, say, like, this isn't normal.
Right.
And in some ways, that, like, I think if I was more open with my parents, maybe they would have figured it out earlier too. But you're more open with your wife in ways that you aren't with your parents. So my wife kind of brings it up, and I'm just like, oh, whatever. Like, pull myself up by the bootstraps. Like, sure, I might feel a little depressed, but it can't be that abnormal.
Right.
And
Well, it's one thing,
um,
like that's my wife says some of the same things too, because like I was raised differently than she was, right? And so your wife
yep.
is probably raised differently than you were. And so for someone who's, like you said, an outsider that comes in and says that it's not normal, it's like, well, what's normal? Because
I've been doing this for 22 years. What do you mean it's not
yeah,
normal?
right. And so and I understand like the different cultures, the different ways people are raised may look different than, what they're used to. But then how do we identify that it actually is abnormal versus, normal? What's the norm, right? And so
Yep.
yeah, that's interesting. So what were the symptoms?
So what I was getting into earlier is kind of the two sides of bipolar. There's a high manic phase and there's a very low depressed phase.
Are
And
they
what
interchangeable,
was
or is it one or the other?
for me personally, it's one or the other.
Okay.
And I think, well, I don't want to speak for other people with bipolar, but people with bipolar will often have this really high manic phase which for me is an obsession with whatever the thing, whether it's origami or gardening, or to the point that, like, absurd. That's a little different. I've gotten to a point now where I can l- discern what's going on, especially with the help of my wife now.
Yeah.
She's an amazing partner, but, like, to the point that, like, I saw a YouTube video about gardening. Suddenly, everything I want to do is gardening. In 3 weeks, I watch 1,000 hours of gardening YouTube videos, spend $2,000 on gardening equipment, and that's what God wants me to do with my life.
Right. I don't know. Maybe I might have to go get myself checked out, because there's a one point in time where I saw videos about like your TV wires look like invisible, or like
Oh
and so
yeah.
I started learning how to do like the internal wall holes and stuff like that. So I did that to my other house. And I was like, oh, it took like 2 months to do that to all of our TVs and our
Yeah.
speakers and all. And I'm like, oh, I don't know.
Yeah, I mean, there's like, it's normal to experience that. Like, people do experience that, but for me, it's like it's God's purpose for me.
Right.
Like, that is what I've always been meant to do. I found this thing. It's what I'm meant to do. And then 2 months later, after spending all this time and money on everything, it just completely goes away. I have
Right.
zero interest in gardening anymore. And then it turns into depression, like standard depression, so most people, when they're going to seek help for bipolar, they're seeking help for the depression. Because in my mind, at least, and in my wife's mind, a lot of the time, like, the mania, the high phase, the obsession isn't the problem. The real problem is the depression, the sadness, the struggle, because that's where the struggle really is.
Right.
Especially when I have a wife who's able to say, like, no, we can't spend money on that right now. And so that's able to kind of rein in some of that, but I'm still spending hundreds of hours on researching things and all of that kind of stuff. And so that was kind of the dichotomy for me. And that's how I experience bipolar, is just these big phases of up, God's given purpose for me, and these huge, like, once that fizzles out, I experience a hardcore depression. And so that's what
I guess you can see that's kind of like the content creating world. There's a lot of people that are hyper focused on certain things in the moment,
yeah.
whether it doesn't work out for them, or it doesn't seem to be going the way they want, or something like that. And all of a sudden, next thing you know, there's the depression that kicks in, and all of a sudden they're quitting
Yep.
streaming, or they're not going live as much as, or they're not creating content anymore. Or same thing with like video games. There's a specific video game that everyone's super hyper focused on playing, and eventually it just fizzles out. Not that the game's bad, or maybe it is, but and I'm not saying that content creating is bipolar, but I guess content creating is bipolar, not necessarily the creator itself per
Right.
se, right?
Well,
So
a lot of those feelings and emotions are very normal for a person to experience, which is why it took so long to figure out what was going on.
right,
Because it can be normal to experience that, like, I have an obsession and now, like, I have nothing to spend my time on, so I'm sad because I don't have this thing. Like I no longer want to research gardening or farming or homesteading tactics.
And you said some of these obsessions you noticed was in high school, or did it happen like in elementary
Yeah,
school and junior
yeah.
high as well?
Looking back, it started fairly young, probably elementary, middle school,
Hmm.
but I had no idea what it was. Like, and in my mind, like school doesn't matter, this fun thing matters.
Right.
And I knew all kinds of kids that were obsessed with playing video games or doing whatever other thing. So it didn't come across to me or my parents as abnormal because everybody kind of deals with that to some extent.
Right. And so here's a tough question, and it wasn't really part of the topics, but it obviously it ties into what the what this episode's about and the DomCast is about, right? So, did at any point during this time, before and after diagnosing, did you ever have suicidal ideations or attempts because of it, or I mean,
I
or as a result of it?
So I regularly experience whenever I'm in a down phase, I experience essentially every symptom of depression that there is, except suicidal ideation. And I don't know why I'm weird in that way. I've just never I've had some what I consider personally to be lower level like thoughts about like would my family be better off if I wasn't here and those types of thoughts, but I've never once thought I'm going to do this, I'm going to end it all, like I'm actually going to do anything about it. I've never been that far. I've
Right.
definitely had periods of self-harm in my life, but that was more as a kid. I think my first major depressive episode, I was 12, 13, and I was cutting my wrists, but it was never out of an intention to end anything.
It was. I think a lot of people tend to, when they first start out doing that, I think it's more or less just to the pain relieves,
Yeah.
the stress, or there's some people that are big. I mean, I think there's a if I'm not mistaken, there's like a I'm not gonna say it's like a disorder or like can't think of the word, but basically there's people out there that just enjoy pain
Yeah.
and I wouldn't say necessarily. And Pain Olympics is a little extreme, but like it's like people like I have a high pain threshold, right? But when I'm stressed out, I'm not gonna sit there and just start hurting myself to relieve that stress. But that's what some people do and cutting
Yeah.
is part of it, right?
Well,
Um,
it's a control. Like there's
right.
something in my life that's making me depressed. I can't control it. My girlfriend broke up with me. The girl that I like doesn't like me back, or
Didn't get
whatever
the job that I
thing
wanted,
is happening.
yeah.
Job that I wanted, whatever the issue is. That's even though it's pain, it's something you can control.
Right.
And pain for a lot of people, not just like in this atmosphere, but pain for a lot of people can be euphoric.
Okay, so after being diagnosed, what was the solution?
So my wife, this is probably a couple of times a year, she's having this conversation with me like something's going on, like you need to get help.
Right.
And what the real problem was not these like manic obsessive episodes. We thought that was ADHD and that I was just like hyper fixated on things, which can also be very normal. And we never thought that the two things could possibly be connected. But so eventually I break down and decide to go get help. Like she'd had enough conversations with me and I started realizing like there's something here that my wife Amy is right. There's something that I can't deal with on my own and I need help to figure this out. And my brother-in-law, her sister's husband, is a therapist. He specializes in EMDR.
What's that? What's that?
So it's eye movement desensitization and reprocessing.
Mm, okay.
So it there are a lot of theories about why or how it works the way it does, but it's not like traditional talk therapy or anything else. It's the way that he did it, it basically tricks your brain into thinking that you're in a dreamlike state. And
Okay.
it's not like
Hypnosis or
hypnosis
anything.
or
Yeah.
anything like that. It's just there are certain like patterns. So a lot of what he does is like tapping one knee and then tapping the other knee and you're focused on this movement, or he'll hold up his finger and move it back and forth so that you're focusing on this like back and forth like. And so in some ways it is sort of like
What's getting you to focus on one thing versus
it's getting you
focusing
to
on multiple
focus
things?
on one thing. And some of the theories around it are that it gets your body into a dreamlike state and you're able to kind of tap into parts of your unconscious that you aren't just able to access normally.
Right.
And the way that he does this is really big, long, single sessions. So instead of like an hour once a week, especially if EMDR, it's 1 8-hour session or a 10-hour session of just like focusing on these patterns, going deep inside yourself. And like, I have zero recollection of like, my eyes were open the entire time following whatever pattern he was doing or whatever was happening. But I have zero recollection of like seeing him. Like, everything was all in my head.
Yeah.
And the closest thing that I could relate it to is almost like some type of psychedelic or like I was dreaming.
Or Inception, I think it was. Isn't that a movie with the?
Inception.
Yeah.
Yeah.
That's
Yeah,
interesting. It's crazy.
it's a lot like that. And most of what it's used for now is actually PTSD in military veterans.
Hmm. That's awesome.
I think that's the most common use for EMDR. It's intended for people who have been through large trauma. That's
Right.
most of how it's used. He uses it a little bit more kind of for everybody. But so I go and I do this. It's one big like 8-hour session, and there are things that came out in this that as part of it as well, we did like the typical DSM-5, like, do you have depression? Do you have anxiety checklists?
Right. I think that's one of the checklists I
And
have to do for my kid.
yeah. And so I think part of my problem, I think, in how long it took to figure out what the problem was, is I knew the symptoms of depression.
Right.
And so without knowing it, I knew going in to say X, Y, and Z is the way I feel and point things towards depression,
Right.
because that's the part of what was going on that was the issue. So I was never expressing like the opposite side, the mania, the manic parts.
Okay.
So we go through that. Some things come out that make my life a little bit more difficult for a short period. It was EMDR was really, and I I say this, I should probably do more EMDR, but it was a very, very emotional experience because you tap into parts of you that you don't normally get to access or experience.
Right.
And I just, the trauma of that and facing your trauma raw, not just like talking on a sofa about stuff, but experiencing that raw can be a very traumatic experience on its own. And I wish I could better explain what exactly I felt and experienced, but it's just hard to put that into words, like what EMDR is. I struggled with pornography through my entire life. And so, like, starting at age 12, and I hadn't told a single person ever, and I was never going to.
Until now, or
And
before you've already told somebody?
no, 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 no.
Okay.
As part of the EMDR,
Yeah. Yeah.
it just came out, and
Yeah.
I had zero like, should I say it or should I not? Like, because I throughout my whole life, like I thought, like, well, I should tell somebody, and then you get all in your head, like, no, I shouldn't tell anybody.
You're talking about like an obsession with it, or what do you mean you struggle through pornography?
I just had, I wasn't obsessed with it, but I had what I would call a pornography addiction for
Okay.
my entire life. Like, I just, it didn't like destroy my life or anything,
Yeah.
but it was something that, especially in my relationship with my wife, she should have known about.
Yeah. I mean, 12-year-old guy, learning about things and curiosity,
Oh
and
yeah,
I mean, I think that's kind of normal
I
to
agree.
that. I guess I guess I don't know what's the norm at what age that you kind of stop looking at porn or seeing. I mean, I know there's some religions out there that are very against it, and I guess that makes sense.
Yes, and that is very like, we are both of a religion that is very, very strict about that kind of
Okay,
stuff.
that makes sense too. I mean, I'm not saying
And
that porn is good for everyone, but I mean, like,
right, and I'm not trying to say that porn is necessarily bad. Like, everybody you should make your own decision about that. But
but if you're
I
watching it
struggled with
12
it to the
hours a
point that I
day,
could not stop.
yeah.
Yeah, also true.
So
And so there were some things that came out like that I like, my life is infinitely better for having come out, but that added, I think, kind of to the stress of this EMDR thing that I now no longer want to do ever again in my life, even though I think everybody needs to experience EMDR because it changed my life. And there was, up until that point in my life, I was a gym freak. I was a gym rat. I spent
Yeah.
2, 3, 4 hours in the gym every day from like 15 until now. This is happening at like 24. And as part of the EMDR that came out, there was a voice in my head that, like, I never heard the voice in my head, if that makes sense. Until I was put in this EMDR space, I could hear the voice telling me, like, you're fat. No one will love you. If you gain weight, your wife will leave you. Like, I heard this in my head. And because of EMDR and confronting it, dealing with it, like, I was able to cast that out, if
Right.
that makes sense. And so to this point in my life, that had a lot of weight that I didn't even realize was there. And so I think that whatever that issue was, I think was a lot of why up to that point I had experienced symptoms of depression. So we do that. My life gets turned on its head because now my wife knows about this pornography, what I would consider to be a pornography addiction. And that upsets
And here
her,
comes a lot of
upsets our
questions and
dynamic, crushes her. She's now got to deal with like the anxiety and stress of that.
well, who's
But at
this
the same
guy?
time,
Yeah.
yeah, exactly. Because we'd been married for 3 years at the time, and she starts feeling like I have no idea who this guy is.
Right.
Like he's held these secrets from me.
And
But at
then
the
are there
same
any more
time,
secrets?
which still affects our marriage to this day. Like, not that, I mean, we've both largely moved past specifics like that, but it is still like that experience is there. And so, at least for me in my marriage, honesty is a way bigger principle than I think it even needs to be for most people, because every little white lie that she eventually finds out loops back to the trauma of that experience. But at the same time, my life vastly improved because there were these voices that I didn't even know I was hearing in my head and thought were normal about things like your wife is going to leave you if you get fat. If you gain weight, this, you gain weight, that. So I was no longer obsessed with the gym, and that improved things. So I thought, like, we've got this all solved. Everything's fine now. And a few months go by, I start feeling depressed again, and I decide that I want to go to a therapist. I want to do talk therapy. I don't want to do this EMDR thing again because it was extremely traumatic. So I go see a therapist.
Right.
She does another DSM-5 checklist. Comes out I have depression. She confirms the diagnosis. She's like, you've got depression. And so I visit with her for 3 or 4 months, and then I don't want to get medicated for it because not that I don't believe in medication. I do believe in medication, but at that point, it wasn't something that I felt like it was a big enough deal to need to be medicated. Another year goes by. I go through massive up phases and down phases, and I'd been doing Jimmy John's. I'm a Jimmy John's general manager. I'd been doing Jimmy John's for like 7 years now at this point. I
Okay.
was been a general manager for 3 and just started to feel really burnt out and just want out. And I started to get really depressed about it. And so at this point, I decided I wanted to seek help, but this time I wanted to be medicated. I wanted, like, there was something because of the years of wanting to try to get this better and not being able to do it through normal therapy. I decided that I wanted to seek something else that could help.
Right.
So I go to my doctor, who does another DSM-5 depression checklist. I have depression. She writes a prescription, and I start taking, I can't remember what I think it was Zoloft that I started taking, which
Yeah.
is a traditional SSRI antidepressant. And my entire life, I lose all sense of reality,
Right.
starting to
Kind of makes
take
you a
this
zombie.
these anti well, not just that, but I started to lose core parts of who I am.
Yeah.
Like I have these sincerely held religious beliefs that I've held throughout my entire life that I have never once doubted, and just I no longer believe. I am no longer confident in my sexuality. Start
Yeah.
to think like that I'm gay,
Right.
and like that level of like never even had been on my radar in my life. Like things that, and those are the easy things to like point to and say, but like my entire life exploded. And I was on these antidepressants for about 6 weeks. And my aunt, who's a nurse, luckily, like because of, and I wish that I could express the way that that felt. I lost every grasp of reality about who I am.
Yeah.
everything was
And that all started
gone
right when you started taking that medication?
when I started taking the antidepressants.
Yep.
Luckily, I'm very close to my family. My aunt is a nurse, and I started to express like my marriage was extremely rocky in this time because like all of these things that my wife knew about me that I knew about me were no longer true. Like I had no
Right.
idea who I was anymore at all. Talking things through with my aunt, she's like, you need to stop taking antidepressants." And she's like, "Who gave them to you?" And I went to a family doc. Like I didn't even go to a therapist. I just went to my family doctor and was like, "Hey, I need antidepressants." And they wrote me a script there and gave me the checklist. You have depression. Go take antidepressants. The problem is that I did not know, and this is why mental health stuff can be dangerous. And you want to make sure that you have what you've been diagnosed with. Because I'd now had 3 people tell me you have depression, and the problem is when you are bipolar, antidepressants have an opposite effect.
Okay.
Instead of them helping with depression, like I don't know like medically why or how it works with everybody, but it made everything worse. I lost all grasp of reality, and that's when you are bipolar, antidepressants just don't they make everything worse. Like
Yeah.
when they have the symptoms of like some of the symptoms of antidepressants can be further depression and suicide. That is what happens when you're bipolar and take antidepressants.
Right. And that's kind of like what I was saying. I think I don't remember which episode it was, but I know I had mentioned like a buddy of mine who committed suicide. I think it was like a year after I had left because was living in Arkansas for a little bit. And he had severe depression, but he also had fibromyalgia and a couple other
Mhm.
different medical things or whatever. And so that's why I mentioned, like, when you're seeking help for some of this stuff, definitely get a second opinion when it comes to prescriptions, because one thing
Yeah.
may help one thing, but then it may cause more problems for the other things that are going on. Or you you know there's a lot of depression medication that say, okay, yes, it'll help you be happier, but then it goes, oh, but then like small print, it's like, oh, but there are possibilities you might have all 12,000 other symptoms that come with it.
Mhm.
And then not only that, the medications may not mix well. It's almost like building a PC. You have, top of the line GPU, but you buy the bottom of the barrel motherboard. That PC is not going to work very well. It's not going to work together. Same thing with medication. Medication doesn't work well together, and this doesn't necessarily always mix well together. And so, when doctors are prescribing you a shit ton of medications, start asking questions about how are they going to affect you, and what's the schedule? What should the schedule be for taking this and doing that, and what symptoms will this cause? And ask all these questions, because ultimately it's your choice. You don't need to take those just because they prescribe
Yeah.
them to you. Doesn't mean you have to take them. So
Right. Well, and I'd been to 2 other medical professional, like mental health professionals before that I didn't want to take medication. So they didn't even bring it up. Like it wasn't even on they were kind of like, if you want it, like it's there, but I
right.
never followed through with it until like then the time that I ask for it, like that's when they give it to
And
me.
it's crazy how easily accessible it's become too.
Oh yeah.
Because those DSM-5s, like, one, they're a pain in the ass to fill out, but two, it's a lot of like it's one of those checklists where if you fill them out enough, you're just gonna fill out the same answer over and over just to get done with
Yep.
it and over with it. And you're not gonna really read the questions. You already know what they're gonna say, and like nothing's gonna change. It's just you want to make sure, or you might change your questions to fit what you feel is necessary to get help, because it's not getting help the way you
Exactly.
answered it beforehand. And it's like when the medical marijuana thing came out, everyone was going in saying that, well, they got anxiety or they got, glaucoma or something like that. And doctors are like, okay, here you
Yeah.
go, cool, here you go, and that's why there's been a whole epidemic when it comes to the problem with opioids, right? It was easily accessible, and they also falsify what it really was, and this and that, whatever may the case was. There's some really good documentaries on Netflix, but like it was all money thing. It was all sales. It was all numbers. It's really what it came down to. So when doctors are just sitting there prescribing medication for people who have depression, who have bipolar, who have pain injuries and this and that, and like they weren't really prescribing it for the reason that you need it for. They were prescribing it because they needed to make sales, and it was unfortunate. And so
Yeah.
hopefully that wasn't the case for you, but it sounds like the doctor that prescribed you the medication was really quick to
Yeah.
to
And
do
it
it.
it might not be like I don't want to blame the doctor who gave it to me because
Right.
I walked in with I've been to 2 mental health professionals who both diagnosed me with depression.
Yeah.
And so I walk in, do the DSM-5 checklist, and she's like, "Yeah, okay, you come in." Like, I think that's part of why it was so easy is because she trusted in the diagnoses I said I was bringing to the table.
Hmm.
And so I end up going to an actual psychiatrist and explaining like everything that had happened, and he was like, "Oh, you definitely have bipolar." That's
And that was the first time you heard about
the
that?
moment that I was like, "This is what happened when I took antidepressants." He's like, "You're bipolar."
Yeah, and then that was the first time you
He's like,
heard
"This is."
someone actually say you're bipolar?
Yeah, yep.
Yeah.
It was the only time it was ever on the table. And
Right.
he said the reason for that is most of the time it's not the mania, it's not the up phase, it's not the excitement that's the problem. It wasn't my obsessions that was the problem, it was the depression that was the problem. And so how do we get me to not be depressed? Because I don't view these obsessions as a negative because I enjoy it.
Right. And it's
So
not
I'm
and
walking in.
the
Yeah.
exceptions aren't like out of the norm, and it's not like,
Yeah.
extreme either,
Right. Especially when I've had them my whole life. Like it's not like one day I woke up at 24 and had like an intense obsession.
Right.
It had been off and on my whole life. And I just thought like, well, I'm done with my obsession now. I have nothing to waste time on. And now I'm sad. Now I'm depressed.
Yep.
Um so I started taking bipolar medication, which is more meant to help regulate the swings, like the up and down. Like so it brings the highs lower and the downs up. I hope that sentence just made sense.
The high's lower and the down's
S-
up. A
yeah,
little bit.
so that there's not as much mood swing. So you're
Right.
in like the normal spectrum of emotion.
Right.
And that helped somewhat for a while, but I really, at least for me, I did not like the way that it made me feel.
Okay.
And there was one specific medication that I could take, and then there were that's generally like the first one that they put you on, and I don't feel like it helped that much.
It wasn't like
And
more like a test run though, right?
yeah. And we got to a point where there was like a maintenance dose, and I do think it worked, but I think it changed some aspects of who I was
Okay.
that I don't mm, that I wasn't okay. I just without the ups in my life, I didn't feel like I was the same happy-go-lucky person a lot of the time.
Right.
So I eventually stopped taking that medication also because the only way you get all of the other bipolar medications have extreme side effects.
Oh
Like we're
yeah.
talking like
Yeah. Fixes one thing but gives you 15 other yeah.
exactly. Exactly. And so I took the one medication for like 6 months, and my wife and I both got to a point where like just with practice over that 6 month period, we kind of figured out like and through a lot of research, we kind of figured out like this is what these things feel like.
Right.
This is what an up phase feels like. And so I know now, especially being completely open with my wife about things and talking about the things that are on my mind, she she knows, she's kind of the objective observer for me to be like, I'm feeling this way. I want to do this hobby. And
Right.
she's like, well, put the brakes on real quick. Like, let's wait some time to see if it's still something you want to do. And sure enough, a lot of the time it just fades.
Yeah.
And we know what to do in the depressive episodes. Like, and so I feel like we really developed a skill of dealing with it in that way.
Right.
Especially because I have my wife who's an objective observer to be like, hey, this is how I'm feeling. This is, I have this obsession, or I have this sad feeling, or whatever, for her to help. And we've created healthy ways to kind of deal with those things.
That's
So
good.
eventually we tried to stop taking the medication, and everything worked out. Like, I still struggle with the same things, but because we developed that skill of how to deal with it, and I don't know if that's just me personally or if I have like just a little bit of bipolar. You know what I mean?
Right.
Like, however it is, like, we're able to manage it well. And I have a good partner in my life that I can be open and talk about these things with, that just also doesn't shut me down, because she could very well feel that way about everything. Like, no, your obsessions, your hobbies are always these obsessions, and you can't have any of them.
Right.
But she's able to help me balance and like, well, let's wait 2 months, see if it fades, and then you can buy this $10,000 camera
Right.
that I no longer want to buy, because 2 months later it's like, of course that's dumb.
Right. Well, that's good though. That's good that that she's there for you like that, man. That's awesome because like there are people that are in relationships where like it's just, it's my way or the highway, and it's like, you
Yeah.
can't necessarily live that way, and there's a lot of people that like to take control and be in control, and it's good that your wife is there for you in a way that like, let's take a step back and let's see, if it pans out later on, or like, okay, I hear you, but let's sit down and let's give it some time, and if you still feel that way, that's awesome that she's able to kind of ground you that way versus being like, fuck that, like you ain't doing that shit. What the hell are you talking about? You're crazy.
Right.
You're, and start belittling you and doing stuff like that. So that's awesome that she's very open minded and polite to help you get through some of these
Yeah.
moments that you have.
And I got lucky, I think, or blessed, depending on how you look, like what your personal beliefs are and how you look at it. Like, we got married very young,
Yeah.
and I knew what I liked in people, but I didn't know like what I needed in a wife, if that makes sense. And I got
Hmm.
very, very blessed, very lucky with the person that she was, because she's exactly what I need.
I can tell that you guys work well, but you guys definitely
You
look
can
like you
see
guys.
that you can see the dynamic.
I can see the love and admiration you guys have for each other, and it's awesome. And I'm glad that you have somebody there that can help you walk your path through a lot of this and be there by your side. That's awesome. And like present day though, have you been struggling recently? I know you having to go back to work, and you're away from content creating quite a bit now. You're, like you stated earlier, doing more offline stuff, and then when
Yeah,
you're able
I'm
to
I'm
stream
I'm
it,
I'm probably doing just as much as before, just not live.
right. And so, does content creating also help you kind of stay grounded as well? Or do you see some of the manic obsessions that you have with what you're doing with your content, and does it benefit you in some way, or is there a disadvantage for it?
It's a lot healthier, I think. The reason why I eventually got involved in content creation was it was an obsession for a while. It's an obsession off and on a lot of the time. Like, I don't want to say in a negative way though, and I don't think a lot of my obsessions are really problems, because my wife and I know how to handle the situations when they come up. And a lot of the time, like, even though it's an obsession and maybe like a mania, it is a lot easier to manage like how the obsession comes across, because it'll make me happy to do X, Y, or Z,
Right.
like whatever my obsession is. But I now know that the voice in my head telling me like it's what God wants for my life, it's I need to spend 1,000 hours doing it, is no longer like I can talk that down, if that makes sense.
Yeah.
And so I still do, like, I give in to those obsessions quite often. The biggest one, what I enjoy about what I do now content wise, because when I originally got into content, it was just Pokemon Go. That was it. Everything I did was Pokemon Go. And now that I pivoted in July of this year to doing variety games, to doing the 100%.
Hmm.
And it's almost like a little mini obsession on each game. And I'm kind of enjoying that. Like, I think it really adds to and feeds my content a lot of the
Right.
time, because I am extremely passionate about this Zelda game, and now this Metroid game, and now Hollow Knight, and now Mario Wonder with my wife. But it's in a lot more healthy way, because we've learned how to manage it. So the obsessions and ups aren't as much of a problem as they are, because we know how to manage it. The downs, the depressions are still a very real, while I manage them better, and I can even feel that it's coming now. Like, I know myself and my emotions well enough to know, like, just whenever I've had an obsession for a little while that starts to fade, like, I know I'm going to go into a depression, and I can warn my wife, and I can kind of set up my life in a way that, like, can be ready for that fall, if that makes sense.
Yeah.
Because there's no stopping it. Like, I can feel the come up now, and I can feel the come down now, and there's no like thing that I can do or medication that I can take that will just stop it in its tracks.
Right.
And so I have had to learn how to live my life in a way to manage these swings. And the ups, like I said, aren't a direct problem for me. It's really the depressions,
The
the
downs
downs
once
that.
once you get done and over with the obsession and stuff.
Yep, yep. And
Yeah.
even outside of that, like especially going back to Jimmy John's and working as much as I'm working, it takes a toll on my mental health and that kind of down phase, if that makes sense.
I applaud you and your wife for figuring out how to come together as a team and figure out what's best for you. Because then now you guys also know what to do when your kids get to an age where you start recognizing some of the symptoms with them. Think, or hopefully they don't have to deal with it, but in the event that they do, because like you said, you started showing signs of a lot of this stuff from what you remember at a young age too,
Yeah.
and so at least now you can recognize it and you can help kind of guide them down that path of like, hey, let's go get you diagnosed. Let's go see what the deal is. And then, who knows, there might be more stuff, right? And then, that's the only thing that you would have to branch off to find out what's going on and learn how to manage that other things if there is other things. And if it's
Yep.
not, if it's just as simple as, they got the same thing as you do, or maybe they are ADHD, or maybe they are just depressed, then at least you still know how to navigate all that for them and with them. Mental health isn't just about suicide awareness. It's not about just depression. It's also about dealing with stresses, the anxiety, medical disorders that you may have gotten diagnosed later on in life or early on, and how to navigate all that. And I'm glad that you reached out.
I'm grateful that you've done this podcast and given me the opportunity to talk.
No, I appreciate you, man. I appreciate your time. I love this conversation. It was great. Definitely helped open up our minds to more than just the general term of mental health and awareness and struggles. Definitely got to see the insight of how one may go through life not knowing what the symptoms really are for bipolar disorder, or even just simple going through life thinking it's just depression. What medication can do to you and what therapy can help out with as well. And so I appreciate you and your time and then your insight and knowledge on this topic. And I couldn't have asked for a better person to be here tonight with me, man. Thank you so much.
Thank you. Thanks for the opportunity. Anytime. If you ever need anything else.
All right, buddy. Thank you so much, man.
See ya.